Hello, a very good evening, everyone. My name is Dr. Sourav and I'm a senior consultant psychiatrist working at Somnos RTM's clinic, Kolkata. Uh, Today we will be discussing a bit about a new molecule that has been launched. Molecule seems new, but actually it's a very old one which you all have read in our chemistry books in our school. It's magnesium. Okay, magnesium. To be more specific, the new molecule is called magnesium L-threonate. I'll come into that what is the special part of it. So basically, magnesium is quite very much nowadays in talks about, we go to various clinical meetings and CMEs and discussions where magnesium always comes up in the last 1 or 2 years that, magnesium deficiency is a chronic state in most of the people, both who are suffering from clinical psychiatric illnesses as well as subclinical non-clinical people. And apparently magnesium is not adequate in our diet as much as it should be or as much as it is supposed to be, which gives rise to various different conditions, ranging from mild problems to severe problems also. So what are the neurological or psychiatric conditions where we suspect magnesium deficiency is a question that has been asked very frequently. What I personally feel is that magnesium deficiency will not give you a very specific X and Y or Z disease. Rather, what will happen is that uh, there will be a general change in the mood state, in the anxiety state, in the way the brain or the neurocognitive functioning happens in us. So this is more like a broad spectrum thing where we can see that some people who are having a clinical or subclinical magnesium deficiency, particularly in the brain, they tend to be more anxious, they tend to be more wound up, and they feel more low than people those who have adequate magnesium levels in their brain. They can have sleep problems, they do not sleep properly at night with multiple arousals, and there is something called cognitive cortical hyperarousal that is something where the brain keeps aroused or awake and interrupts the sleep in a very bad way, and that causes. And the next day, what happens is the patient feels non-refreshed even after having a good night's sleep, feels tired, is not able to focus properly. So these are the, in a nutshell, the basic symptomatology of the domains where magnesium deficiency impacts, rather than being a very specific particular illness that the magnesium deficiency is there, so you'll have so and so disease. It does not like that. It's like a spectrum. So now the question comes, the another question I often face that what challenges do I face while correcting magnesium deficiency in patients with neurological or psychiatric conditions? See, now the answer to this is very simple. Magnesium is an ion, like is a metal. It's a metal. It's found in the periodic table. It's I think atomic number is 12. It's just after sodium. Okay. Now what happens is that magnesium is less in a person, will give magnesium as supplement. It's available in the range, the price range varies from 2 rupees to 50 rupees per tablet in India. Now, magnesium can be given obviously to raise the magnesium levels, but the challenge is that we as psychiatrists or as neurologists, we do not need magnesium in the blood, we need magnesium in the brain. So, we need one magnesium molecule or a magnesium supplement which has the capability of crossing the blood-brain barrier. That is, from the blood it has to reach the brain. So that is something which is important, and that is where this particular new molecule has been launched called magnesium L-threonate comes into the picture, because this magnesium L-threonate actually can cross the blood-brain barrier, and that causes causes the desired functioning improvement that we want in our patients. So I think the biggest challenge that we face in routine magnesium deficiency treatment is the magnesium. Most of the magnesiums available, they are not able to cross the blood-brain barrier, so they do not help us improve the symptoms that are caused due to low magnesium or magnesium deficiency in the patient. Okay, so my experience with magnesium L-threonate in patients with neurological psychiatric condition like anxiety, depression, insomnia, and stress, I would say it's pretty much good. First, you have to understand that this is not a particular treatment or it's not a medicine that we give when a person is having depression or anxiety. There are many other medicines for that. Where it comes into the picture, that it helps us have an overall global improvement, which kind of acts as a catalyst in the other treatment that we are doing, like the mainstay treatment, maybe with antidepressants or anti-anxiety medications. It adds as an add-on or a supplement. So my experience has been good, because those who have been on magnesium L-threonate along with the other standard treatments, they seem to have a better outcome. That is a clinical judgment, of course. we need more and more large data or RCTs like randomized controlled trials to have this thing on paper as evidence in black and white, right? Okay, another question is what is the usual dose and duration preference for magnesium supplementation therapy in my practice? Um, it depends actually, you know, depends on the patient's age, the patient's body weight, the problem for which I'm considering magnesium patient. For example, if I have a patient who is having sleep problems or not able to sleep properly or adequately, then I would like to give it a once daily dosing, preferably at night time. But again, if there is increased anxiety or there is I want some neurocognitive improvement in attention, memory, focus, and then I can go up to 2 tablets a day, maybe in the afternoon, in the night. So those range varies, but usually in this particular context, I would like to stay between 1 to 2 tablets per day. If you go into the literature, it says that the average dose of needed for magnesium is 1 to 2 grams per day. Okay, so the tablet that we have, this magnesium L-threonate comes in I think 750 mg. So 1 or 2 tablets per day is good enough choice. Now, this is the dose and the duration. I think I give it for a few months. I don't give it for unlimited period. Maybe 2 months, 3 months, 4 months. That's it enough. Now also another thing that is if I'm asked quite frequently is that considering magnesium L-threonate superior CSF bioavailability due to rapid transport by binding with GLUT1 and GLUT3 receptors on the blood-brain barrier and neuronal plasma membrane, do I think that magnesium L-threonate can offer key benefits in patients with psychiatric neurologic conditions? So I think I have already answered that. Of course, magnesium L-threonate crosses the blood-brain barrier in a way more better way than the other standard magnesium hydroxide or oxide salts, and stabilizing the neuronal membrane by stabilizing the glutamatergic system and the other neurotransmitter systems, and having a good night's sleep, having it has been shown to promote more slow wave sleep and more restful sleep, so that itself can also improve the attention and cognition. So I think in a way it's a good molecule. It's a new addition to armamentarium. Now again we have to see if it actually passes the test of time and I can give a better outcome, better experience sharing on this maybe after a couple of years after I use it even more. Okay, thank you so much. Thank you for your time.